Right, and thank you, Simon, as always, and for also setting up the housekeeping rules. Hi, good afternoon, everyone, and thank you for joining us for the COVID-19 vaccinations webinar as part of the NPA Summer Conference. We're going to cover some of the key learnings from the vaccination program so far from people who've been at the front line providing the service, as well as just briefly looking ahead to what's coming next for this program. So I'm Jasmine Shah, the Head of Advice and Support Services here at the NPA and the Medication Safety Officer. I'm also joined this afternoon by a member of my team, Cheryl Amin, who's an Advice and Support Pharmacist. And we also would like to have a share and learn experience from one of the NPA members who's been providing the COVID vaccination service as well. So we'll be hearing from Rahul Puri as well. Thank you, Simon. Next slide, please. So I just want to briefly mention the NPA is currently conducting a member survey on COVID-19 vaccinations and the flu vaccination service. Just wanted to thank you, the large number of members who've already completed the survey. And if you haven't had a chance to complete it yet, then please do so. I've included the link in this slide here. It's been quite interesting just looking at some of the initial results coming through the survey. And one of the key things that we are looking at in terms of the enablers for the service provision have been things like networking, team working, increasing staff numbers potentially through the use of additional staff numbers available through the NHS, etc. So it's been quite interesting. I think what should be noted as well is from what we are seeing in the survey so far, the vast majority of NPA members provided the flu vaccination service last season. And over about 60% of those who completed the survey actually applied to become a COVID-19 vaccination site. And of those who applied, just under half were successful, and there were various reasons for that. And of the ones who have been successfully approved to provide COVID vaccinations, over 94% of them have started providing the vaccinations already. And about 50% of them are providing between 400 and 1,000 vaccinations per week at the moment. Of our members who are currently not providing a COVID-19 vaccination service, either because they haven't had the opportunity to apply so far or haven't been successful, over 91% of them said that they would actually be interested in providing this service if it is still possible to participate in this program. So these are all really great results, and hopefully we'll hear from Rahul in a minute to explain a bit more how he's made it work. Thank you, Simon. Next one, please. So I would like to introduce NPA member Rahul Puri at this moment now. Rahul is a pharmacist at Puri Chemist Limited, and he's an NPA member as well. Rahul has been providing the COVID-19 vaccination service as part of his pharmacy, and he is going to share his experience of providing the service, how he's gone about setting it up, what some of the challenges have been, and how he's made it work, and his top tips on how to engage with it and set up and run a safe and effective COVID-19 vaccination service. So Simon, could we have Rahul on next, please? Thank you. Hi, Rahul. Thank you for joining us. We'd be interested to learn about your experiences with the flu vaccination service, as well as the COVID-19 vaccination service you're currently providing. So if I can start off by asking you, how many years have you provided the NHS flu vaccination service for?
Hi, Jasmine. Thank you so much for inviting me to speak with you on this NPA webinar today. So we have been providing the NHS flu vaccine service since the 2016-2017 flu season, and we've been providing it at both of our branches in Southall and also in Hillingdon every year. And we plan to continue again this year.
Excellent. And how many flu vaccines do your pharmacies administer on average each week, do you think?
So on average, if I can tell you each year, so for example, last year, we did approximately 800. And that was actually our highest amount that we provided at the Southall branch. And at our other branch, we did approximately 500 or so. So that was the highest that we've done. And each year we've seen a very steady rise. And I think more so in the most recent flu vaccination program, we saw an increased number due to the over 50s additional service that was provided, where they were able to obtain their flu vaccine for free. So we've seen a steady growth since we first started our flu service. And we expect that again this year, the uptake to be quite good. and we're just waiting for the additional information to come out.
Excellent. And when did you start providing the COVID-19 vaccination service?
So we officially started our COVID-19 vaccine service on May the 20th. So we're actually relatively still quite new within the service. And we initially were meant to be starting with the AstraZeneca vaccine. And this actually coincided at the same time with stock shortages and also the new information about the blood clots affecting the under 40s. So we started in May the 20th with our original start date, which was actually meant to be 8 weeks before that in early March. So although we're relatively new within our service, we've seen a huge uptake with our vaccines.
It's really good to know. And are you providing the COVID-19 vaccinations from a registered pharmacy premises or off-site premises or an associated premises? How are you actually providing it?
So we're providing all of our vaccines within the pharmacy premises, but it's actually in the adjacent car park, our private car park. And the reason for this is was actually because of the change between the service that we were initially providing. As I mentioned earlier, we were scheduled to do the AstraZeneca vaccine, which I'm sure your members are aware that the monitoring and observing guidelines post-vaccine are very different to Moderna and Pfizer. For example, you don't need to observe them for up to 15 minutes. However, with Moderna and Pfizer, it's very critical that you do.
Yeah.
So we initially planned on using our 2 consultation rooms within our pharmacy to provide the AstraZeneca vaccine. However, this rapidly changed, and therefore we actually installed a vaccination centre within our private car park behind our pharmacy.
And is that from both of your pharmacies or one of them?
So we are providing our vaccines at the moment only at our Southall branch. And this actually coincided with the increased need for a vaccinating centre within the Ealing Borough. When we were having our discussions with the commissioners and those involved within the COVID-19 vaccination service, there was a huge requirement that, particularly within Ealing and more so particularly within Southall, a new vaccination centre that could provide minimum 400 vaccines per week. So that's where we stepped in and provided the service. At the moment, we aren't providing the service within Hillingdon. However, we are looking to do so towards the end of this year. For example, within September, when approximately 1,000 pharmacies will be required to provide the booster.
Yeah, thank you, Rahul. That's really helpful. And so, just so our members are clear, you're currently providing the Pfizer vaccine.
Yes, Jasmine, that's correct. So we are currently only providing the Pfizer vaccine.
Yeah, okay. And you are aware that the shelf life of the Pfizer vaccine, once it's thawed and stored at normal fridge temperature of 2 to 8 degrees, has been increased from 5 days to up to 31 days. So how has this change impacted on or enabled your COVID-19 vaccination service? Has it made it easier?
Yes, thank you, Jasmine. So the change in storage has been really helpful and has completely transformed the way that we provide our service. And I'm sure this can also be extended to the other pharmacies and vaccination centres. So within our first week, we had a very small delivery, which they referred to as baby Pfizer. And this meant that they were giving us approximately 45 vials, which meant around about 270 patients that we could theoretically vaccinate within that working week. Although when we first initially got the vaccine, we were told we can use it within 5 days, our scheduled delivery date was on a Tuesday. However, we were given a time frame, for example, 8 a.m. to 10 a.m., which meant that realistically, we probably couldn't safely or effectively vaccinate on Tuesday because, for example, there may be delivery delays and we didn't want to provide a service and make people wait. So that meant that we had to provide the service on Wednesday, Thursday, Friday, because the 5 days then had become 3. Yeah. And it was very challenging because we had to time everything to perfection. We had to only be able to provide 270 doses. We couldn't really accept any walk-ins. And if there were cancellations, we had to call our reserve lists, work very closely with our primary care networks and CCGs. So the extension from 5 days to 30 days has been revolutionary because what we can do is now distribute our vaccination service across a whole working week, which takes a lot of pressure off our working team. it means we can provide a much more safer and a more effective and more streamlined service. And it's been well received and well welcomed.
Okay, that's really helpful for members. Thank you, Rahul. And in terms of providing the number of vaccinations per week, what sort of numbers are we looking at now?
So since the change in storage, our deliveries have doubled. And this, I think, is quite similar across the board with the pharmacies. So we were initially given 270 doses. That was then doubled to 540. And as we were located within Ealing, we had a few ad hoc deliveries of approximately 1,000 doses. And this was to help support with the Ealing surge, because at the time this coincided with an increase in cases and rates within Ealing, and also the number of people being vaccinated was a little bit lower. So on average now, we're probably vaccinating around about 500 to 600 people in the working week, but with a scope that we can increase this if the local area requires.
Excellent. And how are you providing these number of vaccinations in the week? Is it as part of your regular business arrangements because you had the sufficient space and workforce, or did you have to set up a new dedicated service, and bring in additional workforce? And you mentioned already that you created additional space in your private car park outside the pharmacy. So I think that'd be quite helpful for members to know.
Yeah, of course. So initially within our first working week, we used the staff from our existing pharmacy team. So the clinical supervisor being our responsible pharmacists. Those who were doing the drawing up were trained within our pharmacy, and the vaccinators were those who were trained, for example, the pharmacists. For the first week, it was very challenging. We realized that it's not something that you can really safely provide or effectively provide, because your pharmacy will continue, and all pharmacies are very, very busy. And therefore, making your team now do a whole new service on top of the additional services, it doesn't really work. I mean, we got away with it for a few days, but we realized very, very quickly that we had to essentially create a brand new team. And what we did within a few days is work very closely with our primary care network to increase our workforce. We tapped into the NHS bank staff. We worked very closely with the St John's ambulance team to basically enroll vaccinators, and we effectively doubled our work team. And we theoretically, in a way, created two teams. Our pharmacy team, who are responsible for the ongoing activities of our pharmacy, which every pharmacy team and every pharmacist knows there's a lot to do. So we continue in that respect. And we had a brand new team, which were our vaccinators, those who are involved in drawing up the vaccine, our admin staff, who are involved with all the IT information and ensuring the information was sent to the relevant people, for example, your general practitioners, and our clinical supervising team, who are all involved there. And they were all working within the COVID vaccination team, essentially. And I think that's been a huge step in allowing us to increase our numbers, to allow us to do walk-ins. And also, it really means that your pharmacy can continue to do what it does best, and that's providing exceptional healthcare, doing all the services such as the NMS, CPCS, and continuing with everything that you need to do, and also having your COVID team be in charge of the COVID work. And that's allowed us to really improve the service that we provide.
Excellent. It sounds very much that, within the few days of a steep learning curve, if I might suggest, what you're currently doing now is much, much more risk managed, as well as a greatly enhanced patient safety, I would say, for all your service users, not just for the COVID vaccination service, but for your regular service users as well. Excellent. So obviously, with setting up any new service, there are usually challenges to overcome right at the beginning, and also then monitoring and keeping up with any changes as they come along. So what would you say were some of your biggest challenges or barriers in terms of providing or setting up to provide this vaccination service for COVID-19 vaccinations? And you've already described some of the ways in which you've overcome them, but if you could touch upon perhaps some of the financial costs, as well as the space, etc., that would also be quite helpful, because I think certainly for some of our members, I think the costs are quite a concern right at the beginning. Rahul?
Yeah, of course, Jasmine. So some of the barriers and challenges we experienced and how we overcame them were, well, the first one was really, we were expecting to be doing the AstraZeneca vaccine. And although this may not affect your members more so now, for example, with the booster service coming in, we were in a position where we were all set up to provide our vaccine within the pharmacy premises, within our consultation rooms, and then we were suddenly told, you won't be receiving AstraZeneca, you're going to have Pfizer, and you need to be able to observe these patients for 15 minutes. We're not the smallest of pharmacies, but we're also not the largest. We're an independent pharmacy, and we were definitely not in a position to be able to provide 500 to 600 vaccines per week within the pharmacy premises, because one, there just wouldn't be enough space. It wouldn't have been safe. We wouldn't have been able to provide a good level of social distancing, and we just wouldn't have been able to continue with our day-to-day pharmacy activity, which basically led us that we had to therefore create what we called our local vaccination centre, which was our marquee, and that just required a few phone calls, a lot of Googling to find marquee companies and tent companies. And we were very fortunate that we managed to work with somebody who had some experience with working with some of the local GP practices. And what we essentially did is create I think it's an 18 meter squared vaccination site, which contains what we call 6 pods. So patients would come in, there's room for 6 people to have their vaccines, the same 6 people to be observed, and room for all of our staff as well. Of course, that comes at a financial strain, but the initial setup costs, in our opinion, completely outweigh the financial benefits that you do gain from the vaccination service. Obviously, the other considerations that we had to do is within our first few days, we were using our own workforce, but we realized this wasn't safe to do this for a long-term process. So therefore, we had to advertise and also seek to find trained individuals or unregistered vaccinators that we could work closely with. And again, that comes at a financial cost. But the benefit is there is so much information out there within the local CCGs, the primary care networks, and also through NHS Futures, which I thoroughly recommend everyone to be part of, because the information that you have and the forums that you have available to you are so helpful. And pretty much the majority of information is all through there. So we were able to look at how we could improve and increase our workforce, what rates people would be typically being paid. And we kind of essentially created a very small business model and an idea of, these are the expected costs. And this is what we need to do to be able to provide a safe service. But from a financial and a business point of view, the remuneration and the financials from the COVID vaccine are, they're very good. And especially at a time for pharmacy, it's what you are gaining in terms of per vaccine is a very decent, fee per vaccine. And what I would recommend to all of the members of the NPA who are looking to provide this service is to try and have a look and see at what is your capacity, what is required from you, and what can you do to provide a safe and effective service within your business means. There's a lot of information out there, and by all means contact people and spend time with people and pick up the phone, call me if you like, or speak to anyone who's provided the service to try and see how you can provide it. Initially, I think it does look quite scary because you really are providing a brand new service. And a lot of the information, as we all know, whether it be a healthcare point of view or general point of view, it changes on what feels like a minute by minute basis. But once you take a step back and think, what we are doing is, the way that we looked at it is how can we provide something that is safe, effective, within our means, that allows our business to continue from a pharmacy point of view, and also how can we provide the service in its best particular way. Obviously, we have experience with the flu vaccine service, and I know a lot of pharmacies do provide vaccination services, but for those who haven't provided any vaccination services before, I wouldn't want this to ever deter you away from it, because one, it's extremely rewarding. Yes, it can be challenging and there are obstacles, but what you can do is really just increase the profile of your pharmacy, develop a whole new set of skills. We've learned things on a daily basis. We've learned a lot more about first aid. We've learned a lot more about how to work closely with the local community, speaking to key individuals within our community. We've had long conversations with our primary care networks, our CCGs, our temples, our mosques, our gurdwaras in the area to engage with people. A lot of things that you wouldn't typically associate with being a pharmacist on a day-to-day basis. There is a lot there that you can really do to connect yourself with your local community. And especially for independents, that's such a fantastic opportunity because you can connect with people on such a good level. And also you're providing a service which is, is generational. This is probably something that will not ever, touch wood, fingers crossed, ever happen again to this level. But it's something that, you can really do within your pharmacy to do something that's part of history. So Jasmine, I think one thing that I really wanted to touch upon was there may be some apprehension with people who want to start up the service because of a potential never-ending list of setup costs. And I know from surveys and also from communication and conversations with those within the pharmacy world, people are worried that this may bankrupt them before they even start doing the vaccinations. But actually, the setup costs are very, very low. The way that the service has been provided is that every centre or site or pharmacy, whether you're a small independent pharmacy or a larger scale, you will actually be provided with pretty much everything that you require to set up the service. And for example, without being using too much jargon, there is a supply inventory list, which is essentially a very, very long catalogue of everything you could possibly require. And when we first set up, we had a big delivery of everything that we required. And we're talking about bins for safe storage, personal protective equipment, so gloves, visors, all of the ancillary products and the paraphernalia that's required with the vaccines. So for example, small alcohol swabs for the skin, and also the swabs that are used when you reconstitute your vaccine. The needles are all provided for you. Of course, the vaccines are all provided for you. Pretty much everything is provided. We were also given additional IT infrastructure. We were given an iPad, which allowed us to be more mobile in our vaccination centre. And we pretty much didn't have to buy anything, apart from a few things here and there. But again, even pens were provided to us, clipboards were provided to us. The way that the service is everything has been set up so that you can focus really on providing the service. And it's not a one-off delivery. Every week we get replenishment of what we require. And also if we require anything extra, we can just call up the helpline, speak to people who are extremely friendly, and they will provide things to us as part of our regular delivery or an ad hoc delivery. And again, this is all part of the service. You don't need to pay for any of this. And I think that's something which initially when we started up the service, we weren't too sure, did we have to buy this? Did we have to buy that? Did we need to get chairs? Did we need, cleaning products? Everything is provided to you. And the way that the system is set up is that if you require something, you pick up the phone or drop an email, pretty much within the next couple of working days, it's there for you. And I think that's really beneficial because you don't have to worry about things that you need or you don't need. And everything's available to you. You can have a look at the inventory list. There may be things that you think, okay, I require this, or I don't require this, and it all comes for you. And this is the same for pharmacies who are on a slightly smaller scale, and also those who are on a much larger scale. You don't need to be a pharmacy that has to do, 10,000 to 5,000 vaccinations on a weekly basis. We provide on average 500 to 600 per week. And that's very much within your means. Because if you provide your service on a 5-day working week, or even a 6-day, or even a 4-day, you could easily provide, for example, 150 or 100 vaccines each day, and that will get you to your desired figure. Yes, it can be busy. It's a very fast-paced environment, and you learn a lot every day, every minute. But it's something that is very much doable, and definitely something which people shouldn't be worried about providing because they're worried about particular pitfalls. With every new service and every new service that we provide as healthcare professionals, there's going to be things that we don't know about. There's going to be things that we learn about on a daily basis. So I would never let this deter anyone from providing the service. And as I mentioned earlier, I'm always accessible. If anyone is based in the West London area, Ealing, or if anyone wants to come to our centre, by all means come or pick up the phone. I'm more than happy to talk to people about what we did, errors that occurred in our pathway, learning things that we've done or things that we've done to rapidly change our service. When we first set up our service, we contacted a local pharmacy who had been providing the vaccine since January. And without them, we probably wouldn't have been able to provide the service that we are doing now. And everyone is so helpful. We all know within our pharmacy world, we are all a big family. So it's always good to pick up the phone and just learn off each other. The learning experiences are the most important, and that's allowed us to, provide the service that we are doing. And to be honest with you, every week or every couple of weeks, we actually increase or actually, ensure that our service gets even better and better, because we're learning things on a daily basis. And going back to other things that we didn't initially consider, for example, waste management, waste collection, again, contractually, that's all sorted out for you. So you don't need to set up a new waste management service with an existing company. Everything is collected from you on a weekly basis, and that's all done nationally. So you don't need to worry about anything from that point of view. But if you are, there's about 3 or 4 different teams that are set up: an IT team, your inventory team, those who are involved in all the other systems and software that you're using, and you could just pick up the phone and call them. I can't say anything bad about any of the pathways or any of the other departments that we've spoken to, because everyone has been there to help us.
That sounds really good, Rahul. Thank you for sharing that, because I think one of the key messages I'm taking away from you is don't be afraid. If you want to do this, reach out to peers and colleagues who are already providing the service. And thank you also for offering to speak with other members, in your local area who might be interested in providing this service going forward, as the opportunities arise to become part of this program. I think that's really helpful for members also to understand that, and this is the key thing we keep hearing about the initial setup cost, is knowing that there is a lot of support with equipment and setting up support as well available from the NHS, because the whole way the program is set up is very enabling. It is built in a way which says, yes, there is help available to set everything up so that the pharmacies can focus on actually providing the vaccinations. So that's really helpful to learn about your experience. The other thing I just wanted to ask you about is, in terms of ensuring, a safe and effective service, obviously there are the legal mechanisms like the PGD or the national protocols. There's a choice available for pharmacies about which legal mechanism to use, one or both, etc. But also in terms of the standard operating procedures and the vaccination training, etc. available. What can you share with our other members regarding your experience on that front, Rahul?
So in terms of your standard operating procedures, I would highly recommend the first thing to look at is the SPS website. It's been one of the main things that we've used on a daily basis. It contains all the information that you require. From each vaccine, there's a particular SOP, from looking at the legal aspects, the indemnity aspects, everything you could possibly need. It's all written in a very, very easy way to understand. And that's what we used. And it allowed us to really decide which option we wanted to go for, whether it was the national protocol or the PGDs. We decided to opt for the national protocol because it kind of worked within our workforce and the way that we were going to be providing our service. But every centre can do some things particularly different, or a combination of both. For those who are listening to this right now, they might not understand what's kind of going on in terms of the SOPs and everything. But what I would say is have a look at the information that you have to you. Everything's explained in such an easy way to allow you to understand how you can provide the service. And what it really is, the good thing is it allowed us to understand how we can increase our workforce. How many people, how many vaccinators do we need? Because the SOPs actually broke down in terms of how many vaccinators do you need to provide X amount of vaccines. And that allowed us to be like, okay, so we need to have 3 or 4 vaccinators on a daily basis to provide this number of vaccines in a safe and effective manner. So what I would recommend is have a looking at the SPS website. It's written in an extremely well way that can allow you to disseminate and understand all the information to make your decisions based on the service that you would like to provide.
That's really helpful. Thank you, Rahul. And you're absolutely right. I mean, this is a national vaccination program unlike any others we've had before. It is different from the flu vaccination program as well, of course. And one of the key differences with this particular COVID-19 vaccination program is the introduction of the national protocols, as you quite rightly said. It allows the use of an expanded workforce of vaccinators. But more importantly, also, in order to ensure that the COVID-19 vaccination service is available in a standardized way across all the different settings in healthcare where the service is available, whether it's from a pharmacy or a large PCN center or GP practice or however, the whole point of it is it needed to be standardized. And this is why the NHS has worked with the SPS website, Specialist Pharmacist Service, which is also part of the NHS, to create a set of standard operating procedures which are relevant to all the different settings where the service is provided. And it is actually a requirement of the agreement with the NHS when you provide this service, isn't it, Rahul, that you do use the relevant standard operating procedures provided to you through this SPS service to ensure that it's done in a way, and also because as more information about the vaccines has changed, etc., they will be updated and republished as required. And it allows the vaccination centers to keep up to speed with what's happening, what changes might be required, etc. And it's one hub, almost like a portal for all the clinical information that you need to run the vaccination service. So does that seem like a fair summary, Rahul?
Yes, Jasmine, I completely agree. You couldn't have put it any better. So I would, without doubt, say to everyone who would like to provide the service, or when you do provide the service, is to look at the SPS website, take your time with the information. There is a lot to learn, but it's written in such a way that it's very easy to understand. And the best thing is, as you mentioned, Jasmine, is that everything is standardized, which means that you follow the system, you follow the protocols as you would normally do with any service. And if you have any questions, you can always call the team at the SPS or speak to your peers and colleagues as well.
Absolutely. And I know certainly our own advice and support team at the NPA has received a number of calls from members also about questions. And, we've discussed with members the information available from the SPS, help them to find the right information, etc. So, it's a lot of information available out there already. And there is a dedicated web page on the NPA website dedicated to COVID-19 vaccination service, where we brought in all the links to all these various different pieces of information on there. So that's really good. Now, in terms of, you will have heard, as will have other members, that this autumn, there is going to be the commissioning of both the flu and COVID-19 booster vaccination service. And this will include commissioning it from community pharmacies as well. So how do you feel about this, Rahul?
I think it's a fantastic opportunity for pharmacy, because we can be at the forefront of the vaccination process. We are extremely well equipped and trained to deliver both services. From a business point of view, it's fantastic. Obviously we very recently lost the MUR service within community pharmacy. And another point of view is that it really will help change the perception of the public regarding pharmacy. What we've noticed is that we've obviously seen lots of people who didn't really know that pharmacies or pharmacists or those involved in pharmacy can actually even provide vaccinations. I think it's probably a bane of the majority of our lives as pharmacies and pharmacy staffs, that people don't actually understand what we do and everything else that we do. And I think it's a fantastic opportunity to provide the service, to work closely with people, to allow people to understand that we are more than just sticking labels on boxes. And like I said, we are extremely well equipped. We have an opportunity to spend time with patients, to spend time with people, build rapport with your local community, or people who are coming to your pharmacy. And we've had people who have traveled, 1 or 2 hours to get their vaccines from us. Yeah. Listen, we all know winter is always busy. We're never going to have, a quiet lull period. So yes, there's going to be challenges with it. But the fact that we've been told this information with quite a bit of notice means that we have a perfect amount of time to plan. And planning is the most critical thing to provide both the booster vaccines alongside our flu vaccine service. So take this opportunity now to look to see what the application process is to be one of the pharmacies to provide the service. At the moment, I'm not aware on how they are approaching pharmacies, or if it's going to be an application process. I suspect it probably will be an application process, but we would obviously have to wait until more information comes out. But this therefore means that we have ample time to ensure that we have a workforce. You can prepare a workforce to manage both of your services, because although we have this service in the autumn, you will also have all the other services that you will be providing within your pharmacy, which again will be a very, very busy time. And this is if anything, our first winter since, the main aspect of the pandemic. So it will be busy, but I think it's a brilliant opportunity for pharmacies, contractors, and those to consider being part of this from a health point of view, building rapport with your community, from a business point of view. So I say to people, don't be afraid. Take your time after this webinar to have a look at the information of the SPS, pick up the phone or email people who are providing the service, and try and see if this is something that you feel that you can provide safely and effectively.
Absolutely. No, thank you, Rahul. And I think you've covered in there some of the key messages and tips, almost, I would say, to share with members, to start looking at the information available from now, keep monitoring it, start thinking about the space in the pharmacy, the workforce, etc. I mean, members who will have provided the flu service before will obviously be familiar with the elements of vaccinations. However, as you can appreciate, some of the vaccine preparation elements are different with the COVID vaccines, and that will require a little bit more thought into that. Plus, with the Pfizer, the observation period, especially if Moderna comes into play by then as well. So there will be other things to think through. And also you mentioned the IT systems as well, just making sure the familiarity starts from now, the thought starts going into it. So what I would say is ultimately, in terms of any specific other relevant information to share that will help your fellow NPA members effectively to have the confidence to go and apply for, when the COVID-19 vaccination booster service is put out as expression of interest, and to engage with it. What would you want to say as a couple of key messages, to end this with?
Firstly, I'd say is just don't worry. There is so much information available to you. If you have an opportunity to engage with the service, then please do consider it, or at least just read the information, have a look and see what the requirements are. The information that was sent to us when we first applied was very detailed, and it was like a tick box to make sure that our premises were prepared to provide the service. And if your premises doesn't, then that's okay, because the last thing that we want to do is, make pharmacies and pharmacists and contractors think that they have to provide the service. Yes, provide the service if you can provide a safe and effective service. And this is something that you feel that you can do within your own capacity. Firstly, you're going to be part of something iconic and historical, and it's fantastic from a business point of view. From our point of view, we've added such a huge repertoire of new skills. We've taken new members of staff on board who have never done anything like this before, or who have been involved from a micro scale. They've seen us do the flu vaccines, but now they're actively involved in different things. So from your workforce point of view, it's amazing, because your members of staff are now adding a whole new set of skills, diversifying their skills. And who knows in the long run if this new aspect of the new way of us doing vaccines, that pharmacies and pharmacists and the pharmacy team are going to be at the forefront of this, ongoing. What I would say to people is spend time reading. Listen and read to as many resources as you have available to you. We've mentioned, the NPA today, of course, the SPS. You obviously have the PSNC. There is so much information available to you to take your time to understand how to provide the service. And what I would say to people is that the key take-home messages is not to worry. Take your time reading the information. Pick up the phone or drop an email to those who are providing the service at the moment. Spend a few hours with them, or spend some time in their vaccination centres. We've all been to vaccination centres because we've had our vaccine, so you've seen how it works. And actually, when you break things down and look at how to provide the service, it's like any other service, really. I would always say to people, when you're providing a new service or looking to provide a new service, just forget initially what it is. Look at things from a logical point of view, how you're going to provide something that is safe, effective, and within your capacity. And when you break things down and take a big step back, you actually realize that providing services like this is actually a lot easier than when you look at it from, straight on. And what I would say to people is don't worry. There's so many resources available. There's so many people you can talk to. So, look at this as a fantastic challenge, as something that you can take on this winter. And who knows, going forward, we'd like to think that pharmacies and pharmacists and the pharmacy teams are going to be at the forefront of a lot more services going forward. We definitely know that there's a huge backlog of work for the general practitioners. So I do think that our pharmacy teams are going to be leading a lot of these services. We've seen how new services such as the GP CPCS has kicked off, putting us again at the forefront of a lot of the minor ailments. So take everything on as an opportunity to develop yourselves as independent businesses, as pharmacy teams, and take it as something that you can do. If you apply yourself, you can definitely get the service done.
Brilliant. Thank you, Rahul. Well said, I think. And I hope that this does inspire and motivate a lot of our members to, put themselves forward to provide this service from the booster vaccination program as well. So Rahul, just want to say a really, really big thank you for coming on board and sharing your experience. It's really great to hear all the enablers, how you've approached the whole service provision to provide a safe, effective, risk-managed service, which is safe for patients, service users, etc., across the board. So thank you very much. And let's hope that you continue to grow your service. Thank you.
Thank you so much, Jasmine, and the NPA team for asking us to come today to speak with the COVID vaccine service, and hopefully I look forward to engaging with members of the NPA in the near future. Thank you.
Thank you. Hi everyone, thank you, and I hope you found it useful hearing about Rahul's experience in how they've set up the vaccination service. Simon, if you could have the next slide, please. Thank you. So just want to bring in my colleague Shirel now. Shirel has been actually working at the forefront of the COVID service as a COVID-19 vaccinator. And she's been sharing some of her experience from a clinical perspective, which are some of the patient safety considerations to have into a COVID vaccination service. So Shirel, without further ado, I'm going to hand over to you, please, to talk us through the next few slides. Thank you.
Thanks for having me, Jasmine. It's a pleasure to be a part of today's webinar, talking about my experience as a vaccinator and some experiences around patient safety. I've been vaccinating in the service since January. I've worked in multiple sites, pharmacy sites, as well as pharmacy-led hubs. I started off when we were vaccinating patients in the first and second cohort, so it's been really good to see the service come so far. I think we're all starting to see a little bit of light towards the end of the pandemic now. Everyone that's been involved in delivering the service has been doing a really, really good job, and it's been so nice to be a part of it. So Rahul talked about the SPS website. So I wanted to touch on this from a vaccinator's perspective. It's got some really good, useful resources like SOPs, FAQs, and it's got all the up-to-date guidance. So as a vaccinator, we come across so many patients on a daily basis, like cautions, contraindications, interactions, and allergies that you might need to look into. So the website in most cases helps you answer the questions that you might have. It's got guidance on storage and handling, preparation and administration, and it breaks it down under each type of vaccine. So it's really easy to navigate as well. Added to this, if you have vaccinators that are on board that are not pharmacists, so you might have some dentists or nurses, provisionally registered pharmacists, maybe even pharmacy technicians, I suppose, the site gives you guidance on how these individuals can contribute to the service. So I would say that it's a really useful website to bookmark for anyone providing the service and to refer to as and when needed. Next slide, please, Simon. So here we've got just a breakdown of the site. It's just got a little bit of resources, I guess, that you can look into, some FAQs and what the page looks like. Next page, please, Simon. So patient safety issues. In all services and programs, errors can and will happen. And Jasmine, you'll know this as MSO. Some errors will be relatively minor and some might be serious. And when I was working on site, there were patient safety issues that were identified, like errors with the preparation process. So there have been cases where the syringes were passed to vaccinators by the preparation team. They've been empty, so they've contained air and no vaccine. The volume of vaccines might have been overdrawn or underdrawn, or there might have been air bubbles in the syringes. But in most cases, these errors have been spotted during a second check after the vaccine's been prepared. So it's really important that the individuals that are preparing the vaccines, whether they're healthcare professionals or not, because they don't need to be healthcare professionals to be involved in vaccination preparation, that we mitigate these kind of errors by doing a second check of the vaccination preparation process, or even supervision of preparing. And taking these steps can reduce the risk of vaccine waste. When you're checking the syringes, check for volume, color, consistency, and air bubbles, and that will help you mitigate these patient safety incidents. There have been situations where vials have been pulled, where enough vaccines haven't been delivered for the number of appointments that have been booked. So when you pull vials, you pose several risks, right? So you can risk contaminating the vaccine. You might risk introducing pieces of the rubber bung into the vaccine as well. The uniformity can be varied, and you might even risk mixing different batches of the vaccine if you're using multiple batches at the same time. The temperature of the vaccine can fluctuate, as you might have one vial outside of the fridge and the next taken out immediately out of the fridge. There may be stability variations as well. So both the PGD and the national protocol state that the vials shouldn't be pulled. So it's really important to bear that in mind. There have been situations where inadvertent vaccination has occurred, where the patient's been vaccinated in pregnancy, and this was before the changes to the guidelines in vaccination in pregnancy, right? So we shouldn't be afraid to ask about pregnancy. Now, we know that women can fall pregnant well into their 40s now, and patients, in my experience as a vaccinator, haven't been taking offense to the question. Also, when it comes to patients that are under the age of 39, we know that they shouldn't be offered the AstraZeneca vaccine under the new guidelines, but patients that have been under the age of 39 have been vaccinated in error with the AstraZeneca vaccine, even after this guidance has been changed. So it's really important to check the age of the patient to make sure that the age-appropriate vaccine is administered, especially as the cohort has now come down. The initial guidance was to vaccinate the second dose between 77 and 84 days, and that's now come down to 8 weeks. Where you have spare doses at the end of the day, the date of the first vaccine hasn't been checked, and this has been like in a rush to use up the spare doses at the end of the day. So there have been cases where the second dose has been administered a little bit too early. There have also been cases where a different vaccine has been used to the second dose to that's been given at the first dose. So where AstraZeneca may have been given at the first dose, Pfizer may have been given inadvertently at the second dose. And this has happened where more than one type of vaccine is being provided by the same vaccinator, or we call this station jumping at the hubs. So this is a risk in itself. So you might pick up the wrong vaccine and administer it from the range of vaccines you might have on the day, or you could administer the correct vaccine and then record it incorrectly on the recording platform. But ideally, one vaccinator should be providing one type of vaccine for the duration of their shift, or better still, if you can, have only one type of vaccine provided on any one day, if this is possible. So the guidelines have been evolving since the start of the rollout program. So it's really, really important to keep up to date with the guidelines as they're changing and apply these changes to practice. Next slide, please. The Public Health England COVID vaccination program, the information for healthcare practitioners. Now, this is a document. It's got some very good examples of inadvertent vaccination and what to do if the situation arises. And I'll say that as patient safety incidents can and probably will happen, you need to be aware of how to report them. So we've got the yellow card scheme for reporting adverse events to MHRA, and COVID vaccines inadvertently administered to pregnant women should be reported to the Public Health England Immunisation Department. The patient safety, in summary, I'd just say, if it does happen, just know where to go, what to do. We're always here to help at Pharmacy Services if you need us. And it's all a learning process.
Unmute myself first. Thank you, Shira. That's really helpful to understand and learn about your experience as a frontline vaccinator. And it really sounds like you've been finding it very fulfilling and rewarding as well. And obviously you've highlighted a number of areas of risk, which in any service that, there are risks. It's a matter of identifying them and then taking steps to mitigate the risks, which is where the safety in the service comes about. So thank you very much for sharing that. I think also just looking ahead now to what's coming next. Rahul earlier touched upon the booster program as well, and you will be aware that the COVID-19 vaccinations autumn-winter phase 3 planning document has been released by NHS England on the 1st of July. Now, obviously, the aim or the idea in the plan is to deliver the booster doses of COVID vaccines in a concentrated 15-week period starting on the 6th of September. That is a recommendation by JCVI according to the interim guidance. And also to, alongside this, deliver the flu vaccination program as well. Now, currently, you will be aware that the flu service is provided as an advanced service, which contractors can opt into providing, and the vast majority of community pharmacy contractors do provide the flu vaccination service. From the document and the planning document, it looks very much like the intention is to add in an additional 1,000 community pharmacy sites for the COVID-19 vaccination program on top of those who are currently vaccinating already. So I think we are still awaiting a lot more detail on that in terms of how the process of it will be. Will there be a new expression of interest, and how the 1,000 sites will be chosen or commissioned? So that's a lot of information still awaiting at the same time, and we will keep members updated as soon as we hear more about it. Simon, next one, please. Thank you. So the JCVI's interim guidance, which I mentioned earlier, which advises doing the booster program in a concentrated 15-week period, obviously that is dependent on vaccine supply, actually makes the recommendations to offer the booster program in 2 stages with different patient groups within both of the stages. So the first stage is intended to offer a 3rd dose of the COVID-19 vaccine and the annual flu jab as soon as possible to these patient cohorts, i.e. all adults aged 70 and over, and then in other age groups, those who are immunocompromised, health and social care workers living in residential care homes, and those who are clinically extremely vulnerable. And then stage 2 will open up where it offers a 3rd vaccine and as well as equal emphasis on the deployment of the flu vaccine at the same time to other age groups, all adults aged 50 and over. One of the key things which has been advised by JCVI this time is to open up the flu vaccination program to all adults aged 50 and over this year. So the age limit has already been advised to be lowered. But as I mentioned, there's a lot more information still awaiting on that. So it's a lot of watch this space at the moment. However, we can start thinking about and preparing to see, do you want to apply for the COVID vaccination program should the opportunity arise, and start thinking about the workforce space and how the deployment could work. Next one, please, Simon. Thank you. So I'm going to go through the next few slides very quickly because this information is all available on the NPA website. We do have a range of support resources which we've developed to sit alongside and help members on the flu service and any other vaccination service, and can also support the COVID vaccination program. The main standard operating procedures for the COVID vaccination service are available through SPS directly, and they have to be used as part of the service requirement. But we do have additional documents like conducting risk assessments, as well as pre-screening and other things like chaperone policies and other things. Thank you, Simon. Next one, please. We have been asked a lot of questions about the COVID-19 vaccines in terms of the excipients of the vaccines. And we've contacted the manufacturing companies to find out information about a number of different types of excipients. And we have a chart available which has been found to be very useful for those offering the COVID-19 vaccinations, either as a service or just advising members of the public, who might be interested to know whether, for example, there's egg in the vaccine or not, or is suitable for vegetarian or vegans, or there's preservatives in them, etc. Next one, please. Simon, thank you. Rahul touched upon this earlier to say that he's been working extensively with the local communities to ensure that the uptake of vaccine is good. We are all aware about vaccine hesitancy or the reluctance sometimes to take up the vaccine for a variety of reasons. And there's some supporting information and resources available through the NPA website to help you, and also not just having the discussions with patients regarding the vaccines, but also with your team members as well. Thank you, Simon. Next one, please. Thank you. We also at the NPA offer a vaccination program which covers vaccination preparation as well, and further information is available on the NPA website regarding that. Thank you, Simon. Next one, please. We are asked quite frequently about professional indemnity for administering COVID-19 vaccines. And for this and the latest professional indemnity information, we advise to visit the NPA website. There are a number of considerations regarding indemnity, whether the service is provided on the pharmacy premises or at a different premises, etc. And our legal team can advise you in the best way forward and advise you as to how the indemnity can be offered in those circumstances. Next one, please, Simon. And just to say a huge thank you to everyone for attending. I do appreciate it's been a long webinar today, but I'm hoping that Rahul sharing his experience in detail will certainly help you. And if you do have any questions as a follow-up, please do get in touch with the advice and support team. And thank you for attending today. Bye-bye.